Welcome back. We're live on Salam Media on the Mid Morning Talk. We are here with Dr. Kavish Dulabh. Now, Mr. Dr. Dulabh is a qualified chiropractor. He specializes in the treatment and rehabilitation of many neuromuscular conditions. Now, Doctor has a wide field of interest ranging from family chiropractics to sports injury management. He also deals with the treatment of babies and children as well. Now, Dr. Dulabh is based in the Lenasia area in Johannesburg, and he's also a part time lecturer at the University of Johannesburg. Here, he lectures students of chiropractics. And yeah, so welcome, Dr. Dulabh.
Hi, Fazila. Thank you so much for having me, and good morning to our listeners.
Thank you for joining us, Doctor. I know your schedule is quite heavy, so it's really an honor having you here with us. So let's just get
You're most
straight into
welcome.
it. Coming into the 30s, we start noticing pains that we never knew were there before. So, of course, you're the person to speak to when it comes to alleviating such things, in the best way possible. So, not many people actually know the value of chiropractic care. What is the value of chiropractic care to patients?
So that's a very interesting question. In a nutshell, chiropractic is basically a healthcare profession that specializes in the diagnosis, treatment, and management of neuromuscular skeletal conditions. So that is quite a mouthful of a word. What that simply means is conditions associated with the muscles, joints, nerves, bones, tendons, and ligaments, as well as the discs of our back. In simple terms, soft tissue. And with chiropractic care, it's a form of complementary or alternate healthcare. So, what is so special about it is that we follow a drug free approach in the management of our patients' conditions. So, as opposed to just giving them a pain tablet, which is not going to treat the condition, it's only going to mask the symptoms for a short period of time before it actually comes back. With chiropractic, the aim is to find the source of the problem, to treat it from there, together with a few lifestyle changes that we would advise our patients on, and that would actually heal them and have them have a much more better quality of life.
That is excellent because when you come to think of it, medication, you can only take it for a certain amount of time. You can't, or no one wants to live on medication. So I would think, having these things like lifestyle changes is more of a permanent solution to these problems that people would have, right?
100%.
So, like I said, when we start getting older, we start feeling things that we never thought. We start realizing, wow, okay, so we do have bones there that start paining, muscles that pain there and there. So, tell us, what are some of the causes of things like common back pains, joint pains that people suffer from? What are some of the causes of these?
So there are quite a few different conditions that tend to present with pain in the spine. When we refer to the spine, we're referring to the neck, the mid back, as well as the lower back. And this can affect our elbows, our feet, our knees, and so forth. One of the things which are quite common is, and this is degenerative joint, to prefer using the term degeneration rather than osteoarthritis because as we get older, we start changing. For instance, our hair turns gray, our skin becomes a little bit more looser, and no exception to the bones and joints of which starts to degenerate, our bones start to become a little bit weaker as well. And as a result of this aging process, it tends to cause these aches and pains to come along. With that being said, certain conditions can increase the risk and speed this up even quicker. For example, if we have a poor diet or excessive weight, or if we've been involved in a motor vehicle accident or had any previous trauma, these are certain things that can speed this up. Apart from osteoarthritis, other conditions include things like our disc herniations, also known as pinched nerves. And I'm sure many of our listeners have experienced excruciating pain in the back, running down into the leg or into the buttock. And this can be as a result of picking up something incorrectly. Or in this day and age, we tend to have people sitting for prolonged periods of time. which tend to cause weakening of these discs that can eventually put pressure on these nerves. And this is something common in this day and age that tends to affect individuals as they get older as well.
So, doctor, you touched on, working on ways to treat these things, working on ways to make a few lifestyle changes. What are some good habits to adopt to actually try and alleviate these aches and pains that we have?
So a lot of it boils down to having a healthy, good posture, because a key to good posture results in prevention and management of these aches and pains. And posture affects us in many ways, whether we are standing, walking, whether we're sitting, be it in front of a desk or computer, or with our cell phones or tablets in front of our face, as well as driving. And many people don't even think about their posture during sleep, which is something they spend a lot of time doing. So if we can make changes to our posture, doing certain things the right way, it makes a huge difference in alleviating whatever aches and pains these individuals do have, and also preventing it from progressing or becoming worse in the future. So postural management is one of them. Another very important aspect is to start getting a bit more active and a bit more fit. And I don't necessarily mean going to the gym, but anything that gets your body moving. I like to follow the motto, motion is lotion or movement is medicine. And that simply means the more we move, the more we're getting our joints lubricated, the more we engaging our muscles, making our bones stronger. So that makes a big difference, whether it's doing Pilates or doing yoga or kickboxing or aqua aerobics or even a little bit of strength training at the gym. That makes a huge difference in alleviating this and giving you a good prognosis in the long run.
Yeah, those seem like things that are doable. Like you said, little bit of action. You need to have some movement in your body. And it's key for people to understand that it doesn't take you going to the gym for you to actually have a good lifestyle habits. It doesn't necessarily mean going and running and being on exorbitant and crazy diets. It just simply means having simple lifestyle changes that will assist with this. Yes.
Certainly.
So you
Certainly. Many
spoke on,
people, yes.
yeah. No, you were saying,
No,
doctor?
go ahead. Please go ahead. No, please
Okay,
go ahead.
fine. So you were speaking on good posture, right? And you said that it's you have to have good posture management. So I want to pick your brain on what does it actually entail to have good posture. But we're just gonna take a quick break, and when we get back, we're gonna hear from you on that.
No problem.
Fresh. Listen to Salam Media.
There's no smell that takes me back to the comfort of my childhood than the smell of black seed oil being applied by my nanny. Now I'm using Tib black seed in my own home to soothe sniffles and coughs, to help with digestion and immunity, and of course, as part of my beauty routine. After all these years, I've come to appreciate the wisdom in finding comfort and shifa in trusted treatments like Tib black seed. You can find Tib black seed at all leading pharmacies or find out more at blackseed.co.za.
Over 33 million people have been affected by the devastating floods in Pakistan. Homes have been destroyed, crops have been swept away, and roads have been damaged. Families are mourning their loved ones while trying to survive these horrific conditions. Penny Appeal is on the ground now, delivering food, shelter, medical supplies, and water to those in need. You can help save a life by donating today. Visit our website www.pennyappeal.org.za or call 031 1100 573. Penny Appeal South Africa. Small change, big difference.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness, and every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. Come to us. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and free zakat calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
When the perfect blend of stylish decor, exquisite halal cuisine, and warm hospitality come together, it could only mean Albeit Lodge, your true home away from home. Albeit is the ideal heaven for families, business people, and tourists with its 4-star family rooms and other luxurious facilities. Conveniently situated close to Port Elizabeth Airport, the beach, and other amenities, your stay will be truly unforgettable, as you'll be taking home lasting memories of the warm hospitality, the serenity and tranquility that Albeit has to offer. For reservations, call 041 583 6415 or visit www.albeitlodge.co.za.
It's a new beginning. It's a new era. Salam Media, humanitarian journalism.
The time is 11:18 and you're tuned into the mid-morning talk on Salam Media. So with us, we have Dr. Kavish Dulabh, who is giving us some excellent insights into making sure we take care of these body aches and pains and how to maintain this. So doctor, before the break, we did speak about good posture, and I just want to know, what does good posture entail? What does this mean? How can we have good posture?
All right, so posture is something that does take a bit of time to see good improvement with. However, I always advise my patients that we work on baby steps. If you work on baby steps, eventually you do get to the goal that you envision yourself in. So, of course, we go through a variety of different positions throughout the day, whether it's standing, walking, sleeping, sitting, and so forth. So each of these positions have their specific set of postural checklists, I would like to add, that would help in sort of getting your body to that ideal posture that you'd like to be in. So if we take a look at sitting, for example, in this day and age, which we call the digital era, a lot of us are in front of a desk, in front of a computer, in front of our phones. And as much as we love to be nice and straight, at some point we are starting to hunch. And this is because we're not following the correct measures that are there to keep us in place. So it's always good to get a good chair to sit on, something that has good stability. We now have ergonomic chairs, which are specifically built for good posture. However, if many of our patients can't afford that, a good old simple dining room chair is good enough. But applying certain measures make it all the better. For instance, placing a little pillow behind the back, so it tends to push our body up. That makes a big difference in getting our posture nice and upright, and also pushing our shoulders back. Also, if we do find ourselves in front of a computer or in front of a desk, it's best to have the device more or less at eye level. In that way, we aren't bobbing our head forward and looking into the device that causes us to have this hunched position. So trying to keep your cell phone or your tablet or whatever it is more or less at this level, so that you're moving your eyes as opposed to moving your entire neck, which is going to result in a host of conditions and issues with your neck and your back and so forth. The same applies to driving. Try and have your seat more straight. Try and have your chair closer to the steering wheel so that it minimizes that gap for you to hunch forward. With sleeping as well, there are certain measures that we can apply. Generally, we've got 3 sleeping positions. We've got our back sleepers, our side sleepers, and our stomach sleepers. According to healthy posture, it's recommended that we sleep on our side with a good supportive pillow under our head and our neck, a pillow between our knees, so it keeps the spine in that neutral position. If we are sleeping on our back, it's always good to have a little pillow underneath the knees, so it also keeps the spine in that neutral position. With our stomach sleepers, it is generally regarded as the most unhealthy position for sleeping, because this tends to throw our neck in a certain position for a long period of time. The arch of our lower back tends to be very compressed during this movement as well. So I would advise all our stomach sleepers to try shifting to their back or their side in the long run, it's going to be healthier for the spine. And if they are suffering from any ailments or pains, it will make a big difference in improving that as well. So those are just some of the good postural pointers for certain things that we do on a daily basis.
As you were giving these instructions, I kept on coming up. You said, push your chair in, come up, and I tried it, and it actually works. It starts alleviating a bit of
It
the pain
certainly
that you
does.
start
I was looking at you doing that as well.
every time you spoke, I moved, so that's perfect. All right, so there's different techniques I know that chiropractors use when dealing or dealing with treating people, right? What are some of these techniques that are used?
So the techniques that chiropractors use will vary from practitioner to practitioner based on the training that they've had and based on what they've sort of made the mindset of their practice. However, with chiropractors, we focus a lot on what we call spinal and extremity manipulation. All right, that is one of the tools that we use in our treatment, and we'll chat about that in a bit as well. So the spinal manipulation is something that we tend to use a lot of, that tends to restore joint function. It improves mobility and flexibility, it increases blood flow, and most importantly, it reduces pain to the area as well. Chiropractors also do a lot of techniques or treatment methods for soft tissues being our muscles, nerves, joints, and so forth. So this involves different massage techniques. It can involve certain machinery such as electrotherapy or ultrasound therapy or shockwave therapy, which aid in improving the patient's condition. And there is also something called dry needling that chiropractors use very commonly. It's actually different from acupuncture. Many people tend to confuse the two a lot, but the dry needling is an excellent technique that releases muscle tension together with the additional stuff that we as chiropractors do. And that is something that definitely gets our patients to where they need to be.
You did mention spinal adjustment. Talk us through that.
So spinal adjustment is a technique that chiropractors use to restore joint function. Previously, it was called an alignment. However, we tend to move away from the word alignment because that almost makes it sound as though we're now popping something back into place that was dislocated. So we tend to use the word spinal manipulation, whereby we as chiropractors use our hands. We use a certain technique to apply pressure and force on the joints, whether it's the neck, the mid-back, or any other joint of the body. And that force that we apply increases movement in that joint, because essentially as a result of whatever condition the patient has, whether it's an arthritis or whether it's a whiplash injury or perhaps just from sitting too long and being stiff, that joint isn't moving as nicely. So when we chiropractors do the spinal manipulation, we induce movement in that joint, and that increases the pain receptors, or rather it increases the circulation in that area, and it also dampens that pain signal from the joint to our brain, and that's what gives relief. And of course, during the manipulation, you may hear a popping sound similar to when a knuckle is being cracked. That simply just means the air bubble within the joint is being released. We call that a cavitation. And the cavitation doesn't determine how well the manipulation was done. In certain cases, we may get a loud cavitation. In certain cases, we might not get a cavitation at all. But essentially, we are moving the joint, and that is the crux of the treatment.
Oh, sounds interesting. It sounds a little scary when we hear things cracking and we get a little scared. But of course, that is the reason why we come to the professionals like yourself to get it done. So while I have you
100%.
here, Doctor, so this weekend we had a black tie event, and I don't wear heels, and I decided to wear the heels, and now my calves are angry with me. Should I have stretched before putting those heels?
Certainly, certainly. They say with your passion can become your poison, and I think in your case, your passion was your heels. Right? So that's a very
100%.
good It's a very good point because our muscles tend to stiffen up over time, especially if we are inactive or we are spending time in one particular position for too
Yes.
long. And now changing the dynamic, for instance, wearing heels, something that you aren't too used to doing, that you've now been sort of, engaging in, that tends to cause the muscles to become a bit angry. So stretching is key. It warns the muscle that, you know what, I'm placing you in a particular position. You need to be prepared. So there is an excellent thing that patients can do in order to obtain relief, whether it's stretching the neck, stretching the lower back. Essentially, any muscle of the body can be stretched or strengthened. So the more we stretch, and of course, doing things like Pilates, yoga, aqua aerobics are essentially stretching as well. So the more we can increase that movement in the long run, it's definitely going to make a huge difference, and it's going to avoid slip-ups like episodes of pain when wearing high heels.
Great. Thank you so much for that advice, doctor. So tell me, how can people get a hold of you? Contact number, social media, how can people get a hold of you?
Sure. So they're more than welcome. I do have a Facebook and an Instagram page as well. I go under the name Dr. Kavish Dulabh Chiropractor. They're more than welcome to.
Doctor, are you there? I think it's a bit of a network issue or with the phone. Okay, I think okay, doctor's coming back.
Apologies.
We lost you for a bit. Okay, now we don't have any sound. We cannot hear you. You're on mute. Oh, I still can't hear you. Okay, it's fine, not a problem. That was Dr. Kavish Dulabh. Doctor, thank you so much for joining us on the show. That was absolutely enlightening. We now know what good posture is and how to take care of these body aches that we have. Thank you so much for joining us and have a great day further.